For more on the latest climate and health report, let's speak now with Amir Sapkota. He's professor and chair of epidemiology and biostatistics at the School of Public Health at University of Maryland. Professor, to tell us how climate change poses a significant threat to reversing decades of progress towards better health and well-being. And can you specifically highlight the most worrying types of pollution and their health consequences?
Well, first of all, thank you for having me. I think one thing that's important to realize is that climate change is killing people, making people sick now. I'm not talking about 100 years or 50 years from now, but at the present. It's killing people and making them sick. While the direct impact of climate change is easier to see, like the heat wave related death or the cold wave related death or flooding related death, but there are also indirect impact of climate change that are equally important, such as diarrheal diseases, increases in dengue fever, increases in malaria incidents. All of these are consequences of climate change, not to mention about the increasing air pollution that are also tied to warming temperature. So those are all examples of how climate change impacts our health at the present.
Now, the report is clear that climate change is bad for our health, as you've just elaborated. It also states that climate services will save lives. In terms of these services, where has the most progress been made and what areas need the most improvement?
So the area that we have made most progress is with regards to early warnings for heat waves, right? So there are, for example, a lot of places, a lot of countries and a lot of cities have a pretty good early warning system for heat waves. So if there's a heat wave is forecasted to be on the horizon for the next few days or next week, then the warning goes out and, public health professionals react to that, opening up the cooling centers and so forth for people that do not have access to air conditioning. But where we do not have such a system in place is for a lot of other indirect health impacts that are hard to see. Also, you have to think about, when it comes to public health response, it takes time a lot of time to prepare. So for a lot of other things, we need these early warnings with a much longer lead time. So rather than few days, we need to know weeks, even month ahead of time, so we can prepare for this ahead of time and respond to them when these things happen.
You mentioned early warning systems for extreme heat, but also the report also mentions pollen monitoring, satellite surveillance for climate-sensitive diseases. Could you elaborate for how effective these measures are in mitigating climate-related health risks?
So these are sort of like new ideas that are on the horizon, so to speak. So pollen monitoring is we can actually predict when the peak pollen concentration is going to be as the pollen season starts. So perhaps then you can send out a warning about particularly if you have some asthmatic children in your home, minimizing their activities during the peak pollen season, right? So if the ozone concentration, for example, is going to be very high next day, minimizing their outdoor activities because ozone exacerbates asthma. So those are the sort of like type of warning we can send out. But again, this is like sort of like we're talking about very short term, but there's a lot of work that needs to be done with regards to a longer lead time that allows us to sort of like formulate a much more robust, responses to this rather than just like a short-term reaction to those.
Now, the report says less than 1/4 of ministries of health have a health surveillance system that utilizes meteorological information to monitor climate-sensitive health risks. What's the main reason for that, and is it changing?
Well, we are certainly making some progress to that. Up till now, public health has been sort of, kind of sidelined from this debate of climate change. But now more and more people realize climate change actually impacts health directly. So there's a lot of emphasis on that. We are moving in the right direction, but we have to, also keep it in mind that a lot of places in the world lack such good monitoring system. So it's not that people are not utilizing it. It's just there is no good monitoring system in place. So how can you use it when you don't have the monitors, like the weather monitors in the first place? So those are also the things that we need to work on. And this is where a lot of this, modern technology, particularly the satellite observation and, weather forecasts, that comes into play, particularly in the areas where we do not have this ground or weather monitoring station. How can we use such, sort of like this novel technology, such as satellite data, to fill in that information where the ground monitor does not exist?
Mm. And Professor, this report singles out abnormally high heat in particular. But in light of the projected increase in temperature records due to, of course, the onset of El Nino in 2023, are there any specific recommendations for public health strategies or interventions or policies that can help minimize the adverse health effects of extreme heat?
Well, I think the first thing to realize is what the IPCC report recently concluded, and that is even if we are extremely successful in our mitigation effort, right, because of the changes that have already taken place, these increases in extreme weather events will continue into the foreseeable future. These heat waves will continue to increase and get more nastier in the foreseeable future. So that poses this fundamental question, which is how do we adapt to this new set of hazards as a society? We don't have a choice. We must adapt to this increasing frequency of extreme weather events. So that means we need to get much, much, much better in terms of anticipating these threats ahead of time, preparing for them, and then responding to these threats when it happens, rather than simply reacting. Because up till now, like most of our work has been basically something happens and we react to it. I think that we need to move beyond that and think about prevention, like think about how we can anticipate these things ahead of time. And if we can do that, then we can prepare for it. And if we can prepare for it, then when it happens, we can respond to it. That is the critical thing that's missing. And we need a lot of work moving ahead on that direction.
And with that in mind, and just quickly as well, Southeast Asia is susceptible to all manner of extreme weather events brought on by climate change. What are the main areas of concern that we should be focusing on to safeguard the health of people in the region?
So certainly, when it comes to these climate-related hazards, we have to think about who's most vulnerable, right? So people who are most vulnerable are those that lack the capacity to adapt to these threats, right? So, for example, if you continue on our discussion with the heat wave, when there's a heat wave, who's the first one to die? It's not the people living on the home with the central AC or, like a good air conditioning. It's usually the people that are on the street who lack that access to that cool environment. And those are the ones that get sick. Those are the ones that die off first, right? And then there's also people living with chronic diseases such as asthma, cardiovascular diseases, diabetes, obesities. These are the ones that are particularly more vulnerable. So people in the sort of like lower socioeconomic status, and as well as people with the existing chronic diseases, those are what we consider to be extremely more vulnerable to this climate related threats. And those are the area, those are the population that we should be focusing on.
Thank you very much for your time this morning and your expertise as well, Professor Amir Sapkota from the School of Public Health at the University of Maryland.